a few things. There's just a lot of stress, and I think women are carrying the stress more than anybody else, especially working moms, retired moms who are now taking care of their kids while they're getting homeschooled. So a lot of women, one, are minimizing their exposure to other people because it's like a house of cards. Any little jiggle, things are going to fall apart. So they're delaying care, which is unfortunate because by the time they're forced to come in, things that could have been caught earlier are being caught later. Also, I'm seeing a lot more young women in my practice this year. A lot of stress has caused chest pain and palpitations and a lot of high blood pressure because of the stress. I've seen a lot of teachers, first responders carrying the burden of their work related to COVID. For a lot of patients, it's okay. They get their lab test later, they get their heart ultrasound later, and they still do just fine. A lot of my either elderly patients or more brittle patients, unfortunately, by the time they come in, they've been feeling short of breath for really long periods of time, and they've just kind of shoved it under the rug. And, now they're in congestive heart failure, and sometimes they end up needing hospitalization when the first time I see them back in the office. If they had come into their office visits, we could have managed some of these conditions at home, but patients are getting hospitalized more than they otherwise would have needed to. Women just feel so much responsibility for everyone they care for. They don't want to risk getting their husband sick or their children sick or their grandchildren sick. So women more than men for sure are postponing their care. They just feel so much more responsibility. They internalize that stress, and it's been hard. It's been a rough year for most women. I tell my women a lot of times they'll reach out to me and say, hey, is it okay to postpone this? I would say reach out to your doctor. Most doctors now have the opportunity to do video visits, at least to do some screening to see whether or not it is necessary to come in. I'd say that most of the time you don't need to. Sometimes when your doctor tells you to come in, it's really for a good reason, where the physical exam is going to make a difference, or the EKG or the blood tests or the diagnostic tests are really going to make a difference. And if they advise you to, you should probably go in and do it. But start with the video visit and see if you do. And the important thing to recognize still is that heart disease is the #1 killer of women. In the United States, a woman dies of heart disease every 80 seconds. And women think that maybe breast cancer or other things are their greatest health threat, but the reality is that heart disease kills more women than all cancers combined. The good news is 80% of heart attacks and strokes are preventable. So it's really important to get screened early and screened often, because 90% of women have at least one risk factor for heart attacks and strokes. So I ask women to get regular checkups, make sure they talk to their primary care doctor about getting specific heart disease screening tests, and if necessary, see a cardiologist. I think it's really important for women to recognize that her symptoms, if she's having heart disease, heart attack, are different than a man's, and women, because they don't recognize it's their greatest health threat, and sometimes they're even misdiagnosed by their doctors and the emergency room when they do show up, to be advocates for themselves. So if they feel like anything is really out of the ordinary or wrong, they should seek care. We think of the classic Hollywood heart attack as a man clutching his chest, clammy, sweaty, falling to the ground. Whereas when a woman has a heart attack, it can be a lot more subtle. Women can maybe not even have chest pain and just have jaw pain or neck pain or arm pain, or simply shortness of breath, dizziness, or fatigue. So if anything's out of the usual, definitely seek care, but then also be proactive and stand up for yourself, advocate to really be checked out.